Now we're going to discuss how to utilize a soft mist inhaler. And there are a lot of different varieties of soft mist inhalers. You'll see on the screen that there are several different types that include both rescue inhalers, like this, and actual dosing inhalers, such as Symbicort, Advair, and Asthmanex. When using a soft mist inhaler, they almost all have dose counters on the back. And so if you'll turn around and look in the window on the back, you can see that it's counting down from the maximum doses that are available. Most rescue inhalers have 200 doses. All the other types of controller medications have different doses depending on how many you would use in a month. But all soft mist inhalers usually have dose counters on the back. This current inhaler is what's called a Proventil HFA, which is a type of a short-acting beta agonist. However, all the soft mist inhalers work exactly the same way. You can either use it with or without a spacer. I'm going to demonstrate first without and then once with. So again, as we discussed before, relax, standing up, ready to breathe. Shake your inhaler several times, usually about 5 seconds or about 10 times back and forth with shaking. At that point, you're going to relax, put the nozzle in your mouth, and push the button and a deep breath at the same time. After you've pushed the button, hold your breath for about 5 seconds. That's it. Now, if you're going to use it with a spacer, which I would recommend, especially if you're using inhaled steroids, it's important that you make sure you put everything in the right spot. All spacer devices have 2 separate ends. The top end is what's called the mouthpiece, and you can see there's a little one-way valve inside of there that keeps air from flowing backwards, only forwards. And then the back end is where you would insert the inhaler. So with all soft mist inhalers, they insert into a spacing device like so. You take the cap off of the mouthpiece, push the button, and several slow, steady breaths with your mouth over the mouthpiece. Similarly to before, shake, stick it in the end with the inhaler, and then you're going to push the button and then take 3 to 4 slow, steady breaths because the medicine is circulating inside the chamber. And that's it. When you're finished, take the back end out, put the cover back over your mouthpiece, and you're finished. With all spacer usage, it's important to clean this about once every 2 weeks with soap and water. As you can see, this can unscrew and come off such as that, and then the front end can be undone, and then just let it out on a drying rack to dry for about an hour after you've cleaned it.